Okay, good. So hopefully you guys are all, it is 6 o'clock here on my watch. Hopefully it's 6 o'clock on your guys' watch. If you're in a different state, it may not be 6, but we're going to get going anyway. Hopefully everybody's in the right place. We're doing a presentation on low back pain. My name is Alex Benitez. I'm a physical therapist up here in Mount Vernon, Washington at our Urban Fitness and Health location. And I'm joined by my wonderful colleague, Casey Enderlin.
Yep, my name's Casey Enderlin, if you didn't already know that. And I'm a personal trainer here at Urban Fitness and Health. Okay.
Sorry. So what we're trying to do today is kind of demystify low back pain. This is one of the things that we'll talk about. This obviously is one of the most common things of disability in the United States right now. Clearly, as you can see, everybody's kind of filing in and getting on this call. It's a big bane on our system, and we're gonna just try to make it a little bit more clear and a little bit more straightforward, and hopefully help some of you guys that are dealing with this kind of stuff right now. So before we get going though, please feel free to throw any questions in the chat, but we won't be answering them until the end. But at the end, yeah, if you want to stick around and get some questions asked, please feel free. Okay, here we go. All right, so I'm going to start off with this. So obviously, a talk on low back pain. We want to get into like what is low back pain. And I see it a lot where people are coming in and they're like, well, I got pain between my shoulder blades, or I got pain going down my legs. And while some of those can correlate with low back pain, what we're looking about with low back pain is any pain located around the top and back of your pelvis and sacrum, in the region of your lumbar spine. This wonderful picture has this nice red dot with these electric shocks going to your back. That's kind of where we think of low back pain. Just realize that low back pain is very variable, and it can exist in a multitude of different presentations, and is different in everyone. So just because Sharon has low back pain in a certain way and Bob has low back pain doesn't mean they're going to be the exact same thing. For the sake of this presentation, we're going to be mostly addressing like non-specific low back pain, and we'll get into the definition of that in a little bit. But just realize that low back pain, so stemming from your back, can refer to the hip, can bring on pain to the hip. It can bring on pain down the back of your leg. It can bring on pain into your abdomen. It can bring on pain into different areas, and vice versa. You can have pain coming from your hip that refers to your low back. You can have pain from your kidneys that refers into your low back. So there's a lot of different things that can cause low back pain, and there's not one specific treatment that's going to be the same for all of them. But what we're going to go through here is hopefully give you ways that you can maybe diagnose what you're going through and give you ways that you can kind of keep moving and dealing with this. So, okay, so let's get moving. So first of all, I want to start talking about the prevalence of low back pain in our society. Like I said before, this is one of the most common musculoskeletal conditions worldwide. The most common cause of missed work and disability, and nearly everyone will experience low back pain somewhere in their lives. It's funny when I look up these statistics, and it's like nearly everyone will experience low back pain. I dare you to find somebody that's in their 40s and 50s that has not had low back pain. Like literally everybody has had this. And just realizing that once you have it once, the possibility of reoccurrence within up to a year is 80%. So we go do something and we tweak our back, bending down to pick up a sock or lifting some weight or getting in and out of the car. There's a possibility that that's going to occur up to 80% within the next year. And it's really common for that. It just, the percentage goes up more and more as your life goes on, that this stuff is going to come up. And if we do not address it immediately, quickly and efficiently, this can be something that plagues you and really bothers you for the rest of your life. So we're looking at yearly costs of the healthcare system up to $50 billion. And so $50 billion, you could put 2 people on the moon for the price in 1 year of what back pain kind of causes to our system. So you just think over the lifespan, think of how much money you can save, but not only that, we can help save the healthcare system with unneeded admissions to the hospital and things like that. So I just realized, so when we're talking about non-specific low back pain, that just means like a specific diagnosis or cause of pain cannot be identified in like 90% of individuals. So this is definitely different than like if you fall and you have a fracture, which we'll get into, or cancers or kidney disease or things like this. But when we're coming in and say we wake up and we have an achy back and we're not sure why, or we're bending over in the yard and we tweak something and we have to crawl onto the ground and we're immobile for a couple of days, this is non-specific low back pain. This is something that you get that image, you get that x-ray and they can't find things that are wrong, or you'll get a diagnosis and you bring that to other providers and they won't be able to tell you exactly what's going on. You'll get a lot of like being passed around. So the longer low back pain persists, the less likely individuals are to return to work. And that kind of goes to what we were saying before. The longer you're in pain, the more worse these things get, and the less likely you are to be able to provide for your family and help take care of yourself. But then also looking at low back pain leading to opioid dependency. And then this last bullet point talking about there's really not a good amount of evidence to support opioid medication in cases of non-specific low back pain. But crazily, it's the #1 treatment in the United States of America. And that just blows my mind because all the evidence that I'm reading for this kind of stuff is it just exacerbates symptoms. It makes things worse. It just prolongs the dependency and the issues that we're seeing with these low back things. Obviously, there's medication plays a big role in this kind of stuff, and there's a role for it that can be helpful and harmful as well. So just take that in mind. It's not all bad. Okay, so now let's get into some common red flags in back pain. And so these things are, if you have any of these are things that the medical system is awesome at treating. You get into the ER, you go see your primary care physician. These are things that we need imaging on, we need to see a doctor because of. So if you are suffering from any of these type of things, and we're gonna go over them in a little bit, this is where maybe PT may not be right for you at the moment, but we need to get into the doctor. But this is also something that we as physical therapists and trainers can screen and hopefully get you onto your primary care, into the emergency room. So we're starting with cancer. So risk factors, we're looking at older than 50, you have fever, night sweats, previous history of cancer, or unexplained weight loss. If you have any of these, we need to go get some imaging and get some things checked out. Another thing about cancer is that's something that's not going to change with movement. It's not something where we bend down and touch our toes and that gets worse and we stand back up and it feels a little bit better. This is usually something that's pretty constant. We're looking at like cauda equina syndrome or progressing bilateral neurological symptoms. So these are all like nerve injuries. So cauda equina is a bunch of nerves that sit in your low back. And if not treated, these things can lead to paralysis, altered sensation in the saddle and groin region, and altered bowel and bladder functions, specifically retention. This is a medical emergency. This is something that we need to get into the doctor and we need to get treated right away. Same thing with progressive bilateral neurological symptoms. If these things are getting worse and we're not having any relief with this, we need to go see a medical provider to make sure that we're not paralyzed. Okay, and then looking at fracture. So history of trauma, old age, pain and tenderness with pressure over the lumbar spine, and then being female. These are things that let's get an image. Let's go in and make sure that we can get this treated so that things don't get worse. And last but not least on here, I have infection. So risk factors for this is higher risk with IV drug use, long-term corticosteroid use, immunocompromised, and usually the signs and symptoms are fever, chills, and fatigue. So just keep all those in mind when we go through this. Okay, the next thing, so we talked about imaging for red flags. I just want to go over imaging a lot because one thing that I get in the clinic is a lot of people coming in with non-specific low back pain that constantly are like, oh my gosh, I need to get this image. I need to know what I'm looking at. I need somebody to tell me what is on this image, what's wrong with my back, what do I do to fix it? And I want you to realize that if we're not looking at these previous things, these red flags, the imaging for low back pain is extremely poor. There's good research to support that if you're getting imaging in your non-specific low back pain and you take that same image to 6 different medical providers, you're going to get six different answers, and that's frightening. So the first bullet point, the evidence supporting this is very poor, and understanding that the imaging doesn't show your pain. And I know that can be really hard to understand, but it's the same thing as imaging doesn't show that you're hungry. So if you look at this picture on the right, where's this person's pain? You can't see it. You can just see what the picture looks like. You take a picture of me, if I'm happy, but I have a frown on my face, you can't tell that I'm happy. You can't tell that I'm hungry. The same thing goes with imaging. So I'm sure we've all, or some of us have had imaging where it's like, oh my gosh, we got arthritis, degenerative joint disc disease, bone spurring, disc herniation, spondylolysis, all these crazy diagnoses that are frightening. Just realize that while these can be bad, they can be from injury and other things like that. A lot of these are just, they're normal parts of aging. As we get older, you get into your 80s, 90s, 90% of people are going to be having these things on images. Just because you have arthritis doesn't mean it's going to be causing pain. It doesn't mean you need to get it cut out of your body. It doesn't mean that anything is wrong that hasn't been there for a while. I like to think of them as just wrinkles on the inside. When we get older and our skin gets wrinkly and we get weird spots and like weird growths, like that same thing happens on the inside of your body. And just be aware of that. So, but there's a plus. If you want surgery, you want injections, and you want pills for your back pain, then imaging is the way to go, because that's exactly where this is going. Your image, as a physical therapist, we're not trying to treat you based on your image alone. We're treating you based on your symptoms that you're presenting to us. And it's so often where I see people that get imaging for low back pain, and they see something on an image like a disc bulge on the right side, but their symptoms are on the left. And then eventually they go in, and then now they're getting surgery on this right side when the left was the issue, and it just leads to a mess. So if you can avoid it in non-specific low back pain, imaging is not the goal. If there's a medical issue that persists, like I was talking about before, imaging and other medical interventions are absolutely called for. So that's where we're talking about, like the fractures, the cancers, the infections. We need to go get other medical help for those. That's where the medical system thrives, and that's where we need to use it, not with non-specific low back pain. Cool. Okay, so I feel like I'm just kind of scaring a bunch of people here, but now we're going to go like what not to do when you have low back pain. And just realize that we're going to get into things that you should do with low back pain. That's going to be the bulk of what we're doing. But I just want to get some of these things kind of out of the way first. So we've all heard it: rest and relax, ice and elevate. So what we don't want to do with low back pain, rest is not the answer. Netflix and chill is not something that we should be looking to do. Obviously, it's okay to every once in a while take it a little bit lighter, but we want to make sure we keep moving. If we just sit down and we lay down and we wait for this back pain to get better, yes, over time, so we give it a week, we give it a month, it may start feeling better, but just imagine what's going to happen when you got to go back to mowing the lawn, or lifting your daughter or your grandson, or getting on and off the ground to change a tire, or whatever you have to do. That stuff is going to pop right back up if we do not address it. The more we're resting, the more we're going to start losing that function. We're going to be getting weaker, or we're going to lose our mobility, and things are going to get worse. We talked about it a little bit before, but we do not need opioids to mask the pain. I mentioned opioids play a big role in pain control, but we're just realize that, like those opioids, the Percocets, the Vicodins, the morphine, some of those things just kind of cover things up. They're not addressing the root cause of the issue. And what we need to do to keep this away is to address that root cause. And that's something that we can help you with. We just talked about it before. Don't undergo unnecessary imaging. And last but not least, don't push through unreasonable amounts of pain. I feel like I see two types of people with back pain. It's either the people that are too afraid to do anything and they don't move at all, or I see the people that are just gung-ho and they're just like, man, I'm going to push through until I'm 10 out of 10 pain, until I can't move and I'm crippled. We need to reel that in a little bit. And this next slide, so we're going to go into now what to do when you have low back pain. And this is super, super important. We need to keep moving, whatever that is, in any way that feels comfortable. We need to modify your workouts. And this is something that Casey's going to go into pretty heavily in the next couple slides. And we need to assess our symptoms. So it's, say we're bending over in the yard and we tweak our back when we're going to pick something up. It's okay for the short term to sit down and, okay, what did I do? We kind of panic a little bit. Like you look at my last bullet point, it's also perfectly normal to panic when you get injured. We all do it. I tweak my back, I sit there, oh my gosh, am I going to need surgery? Am I going to be okay? Am I going to walk again? That goes through everybody's heads. It goes through your doctor's heads. It goes through my head. But we need to let those thoughts come, and we need to let them go. And then once we are comfortable assessing it, let's start moving a little bit. We're not going to hurt ourselves by testing it out. Bend forward. What happens when we bend forward? It hurts a little bit. Okay, let's back off. What about when we bend backwards? Okay, these pains that we're feeling, once we stop bending forward, is that pain still there, or does it go away? These are all things that we need to start assessing, and this will give you a good way of how you can start going about this. So like I said, it's okay to experiment with moving, but the key is keep moving. We can keep exercising, and we're going to go into this a little bit later. Okay, so let's get into common treatments for low back pain. And I hear it all the time. Alex, what do I do? Like, what do you think about like manipulation, ice, heat, traction, stimulation, massage, yada, 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 healing touch, Reiki, all these other things? And just realize that these things can be great in helping to decrease pain when used appropriately, but none of these treatments do will improve your tolerance to capacity or load, or change your lifestyle and behaviors that contributed to your low back pain in the first place. But manipulation, I love it. Going to a chiropractor and getting your back popped, it feels great. And what that can do is it gets things to calm down. It gets you to feel better. And now that we're feeling better, we need to use these to start moving again. That's where the money is made. I like to think of our bodies as a pump. We got our heart that pumps blood all throughout our body. We're a mess of hormones and other chemicals that are flowing throughout our body. And if we're stagnant and we're not moving, that inflammation is going to build and things are going to get worse. We need to move. And that's where all these things help. Ice, heat, moving between ice or heat, getting some massage, foam rolling, stretching. This stuff is all awesome in the short term, but we need to really start addressing these issues. And specifically in non-specific low back pain, if it's a load intolerant issue, if you're bending over to pick something up and that thing is really heavy, manipulation, ice, heat, stretching, all that stuff is not going to get you stronger and back to where you go. And especially if we're Netflixing and chilling and resting all the time, we're going to be losing some strength. And these things are just going to get harder. So to summarize this, use these treatments as you will. They can all be good. Test them out just like you would test out your movement. If you feel like it gives you a good amount of relief, awesome. We want to use that as much as we can, but we want to get back to moving. That's the key. Okay, so now let's get into, if you cannot see where this presentation is going, we're going to be talking a lot about exercise here, because that is one of the best things that we can do for our backs. And so I bring up the physical activity guidelines here, and this is from the Department of Health and Human Services. And this is, so they say regular physical activity is one of the most important things people can do to improve their health. And if you look at how many adults in the United States are meeting the minimum physical activity guidelines, we're seeing maybe 24% is, and I would say that might even be an overestimate personally. And so you look at, so we got 150 minutes to 300 minutes a week of moderate intensity aerobic exercise, 75 minutes to 150 minutes a week of vigorous intensity aerobic exercise. And so let's see, where were we? So when we're looking at, okay, so when we're looking at, so we're talking about aerobic exercise here. So if you go down a little bit, adults should also do muscle strengthening activities. So this is not just aerobic exercises where we're getting the heart rate up. And so when we're thinking about moderate intensity activity, well, what is moderate intensity aerobic activity? That's getting out and walking at a brisk pace. We should be getting our heart rate up. We should be getting a little sweaty. And then when we move down to vigorous intensity, it should be kind of challenging to hold a conversation. Our heart rate should be getting up. We should be getting pretty tired when we're doing these things. We should be really exerting ourselves. And I get a lot of people that come in and that are saying, well, Alex, I garden and I do these other things out in the yard and I'm doing housework and things like that. Is this moderate or vigorous intensity activity? And that really depends. For the most part, usually those are not. When we're doing these kind of things, and specifically when you see somebody that's doing manual labor type of jobs, they can be pretty vigorous or what we would consider moderate intensity, but we take breaks and we don't usually push ourselves to those upper limits. When we're getting in the gym and we're exercising or we're going out for a walk, we're hopefully pushing ourselves to the point where we're working hard. When we're in the garden or when we're out taking care of the house, we take breaks. We're like, okay, I'm getting a little tired. Let me take a little bit of a break. But the point is to keep moving and get the heart rate up and get a little sweaty. So additional health benefits are gained by engaging in physical activity beyond the equivalent of 300 minutes of moderate intensity physical activity a week. So realize this 300 minutes of moderate intensity aerobic activity is a baseline. That's a baseline per week. So it may seem like a lot, but we need to get out there and move. And so you may say, but Alex, I'm older. I'm not a normal adult. I'm an older adult. Just realize that these key guidelines for adults also apply to older adults. Cool. Okay, so we can't talk about back pain without getting into some of the complexity of pain. And this, we can have a whole 2 weekends of just talking about pain. We can really get into the weeds on this, but I'm just going to try to dumb it down a little bit here, just for everybody that's on this call. So just realize that pain is super complex. So no two people will have the same pain experience. Barbara, who has pain in her hip or in her low back, and Doug, who has pain in his low back, while they can feel very similar, they may be caused by completely different issues. Or for the same token, they may be caused by the same issues, but they may be experienced completely differently. So just realize pain is usually your body's way of letting you know it's not happy with the stimulus. So let's say touching something hot, for example. You touch it, it burns your hands, you take your hand away. Okay, that was hot. I'm not going to touch that pan again. I'm going to let it sit there. Realize that your body can become conditioned to deal with pain. So for example, things that were painful can no longer be painful anymore. And so let's take it, say we're in the gym and we're working out and we get that muscle soreness and we keep pushing and that gets a little bit more tolerable. Or let's just take, I got baby feet, for example. Whenever I try to walk on rocks barefoot, it kills me. But the more you do it, the more your feet get adjusted to it. And I see people that go running on rocks and they're perfectly fine. It's something where we start slowly introducing our bodies to these movements and they can start to adjust. But in the same turn, especially when we see it with low back pain and we see it with chronic low back pain, you can become more sensitive to these kind of issues or these pains. So things that normally do not cause pain now can cause increased pain. And so let's jump back into touching that hot pan. So let's say you touch that hot pan once, it burned your hand. And now that was the first time you've ever touched a pan. And now you're like, my gosh, every time I touch a pan, every pan is going to be hot. And now we stop touching pans. Or we stop bending forward, or we stop doing these things because everybody in our life is telling us you can't bend forward, you're going to break your back. You can't bend backwards, you can't lift things more than 10 pounds. Of course, there are situations where that is completely necessary. But for the most part, when we stop doing these things, they can start leading to fear. And what we need to do is we need to realize that pain is not something to be feared. We may never completely get rid of pain, and we may always have to live with some pain. And talk to anybody that's aging, there's always going to be some type of ache and pain. But hopefully the stronger we can get you and the more comfortable we can get you with movement, the less pain that we're going to have with these things. And realize that if we can get your strength so that lifting your laundry basket is not your maximum lift, if we can maybe get you lifting 50 pounds, 60 pounds, 100 pounds, so that your 20-pound laundry basket is a little bit easier, we may still have some discomfort with that, but our function is going to drastically improve, and it's going to make our quality of life significantly better. Cool. This is one of my favorite quotes that I've ever seen. It says, if exercise could be packaged in a pill, it would be the single most widely prescribed and beneficial medicine in the nation. And that is so true. And I think the problem with exercise is that it takes discipline, and it takes hard work, and it takes commitment. And sometimes we're going to see results pretty quick, but for the most time, it takes dedication. It takes a good amount of work to get those benefits that we see out of exercise. But if it means we can skip that doctor's visit, that surgery, that injection, that pill, and then we can get back to doing the things that we love, like playing with our grandchildren, getting on and off the ground, doing the gardening or the sweeping, it's so worth it in the end. Okay, so to conclude my part here, non-specific low back pain, it's not a medical problem. This is not something that we should be going into the hospital for. This is not something that we should be getting imaging for. We should not be going to see our doctors and going down this rabbit hole. Just realize that it's a common part of life. Like I said before, it's always funny because it's like most people will have back pain. I'm willing to bet almost everybody will have back pain at one point in time in their life. It's going to happen. And if it's happened once before, remember, it's 80% chance that it's going to happen again. But it's something that we need to get a hold of and we need to start addressing. And movement can be a big part of that. Just realize it cannot be seen on an image. It should not be covered up with a medication. And no one should attempt to cut it out of your body, specifically if they don't know where that pain is coming from. It's amazing to me that somebody's going to slice you open and try to take a big chunk out of your back when they don't even know where your pain is coming from. It's just mind-boggling. Let's address lifestyle factors, including exercise, nutrition, sleep, stress, should be the first line of attack when dealing with low back pain. There's so much more to it than, oh my gosh, I got arthritis in my back, I have pain. That is a piece, but what are we eating? What are we fueling our body with? How much sleep are we getting? Are we recovering appropriately? What is this stress? Do we have 3 other things going on in our lives that could be dragging us down? We need to start addressing all these things before we start moving into those other lines of attack. So, and last but not least, keep moving. Exercise can be so helpful in dealing with these things. It's not even funny. Cool. So that is my part. I'm gonna hand it over to Casey here, and he's gonna get more in the weeds on talking about movement and things you can do to start making your back feel better.
All right, thank you. All right, so yeah, hopefully we've convinced you that exercise is probably your best option for dealing with back pain. And you know, most people don't want to have to go into surgery or take all the pills. And so guess what? Exercise is what we're going to do. But like Alex said, it takes some discipline and it does take a little bit of know-how. And that's why we're doing this presentation, is to help everybody kind of understand where you should start. And as a personal trainer, I deal with a lot of people who have back pain because it is so common. And a lot of them just don't want to work out as soon as they have back pain because they're scared they're going to make it worse. And so what I'm going to talk about is, how do we go into exercise without making things worse? How do we make it tolerable, and how do we keep doing it over and over and over again? Because that is the key, is you have to show up and work out consistently. Okay, so the first general rule: if it hurts, modify it. It's like that simple. Your body is telling you, I don't like that. It is responding to the stimulus and saying, that was bad. And so there's 3 basic ways that you can modify any kind of exercise. You can reduce the load, which would be the weight or the intensity. So if I'm running, my load is essentially how fast I'm running. What am I pushing my heart rate to? We can reduce the number of reps. That should be pretty obvious. How many times am I going to do this lift? How far am I going to run? How far am I going to bike? And the last main way we modify something is by adjusting the range of motion. And this is a little bit more complicated. And we'll show a couple modifications to limit range of motion. But essentially that is, if I'm squatting, I don't squat as deep. If I'm doing a leg extension, I wouldn't extend my knee all the way. If I'm doing a Romanian deadlift, I'm not dropping down as low. But range of motion is also going to be important through the back, and we'll go over that a little bit later in my part of the presentation here. So cardio is probably the simplest place for everyone to start working out because you don't actually have to join a gym or anything. You can start by walking your dog down the trail in the woods. Other options are biking and a stair climber. The reason we chose these three forms of cardio is they're what's called low impact, which means you're never really leaving the ground and your back is not taking like a shock to it. And a lot of people do find that when they start out with generalized low back pain, those high impact exercises do bother it a little bit. So go for a walk, go biking or climb stairs. Your back will not be taking all the shock, but you will still be getting that heart rate up and you will still be moving. So some basic modifications. What we're going to do is we're going to show you some video here. So leg up to limit your lumbar movement and a split stance. So we'll just show that to you guys real quick. Here I am taking the chair. So for the leg up, we do have to reach kind of a minimum height on this, and chair height is generally going to do it. We're trying to get the knee up to about even with the hip, get 90 degrees. And what this is going to do is this is going to reduce the amount of flexion in my back. So a lot of things like overhead lifts and curls, a lot of people tend to rock their back, and they're using muscles that tend to be sore during generalized lower back pain. So by just putting this leg up, I'm going to reduce the amount of movement I'm going to get there, limiting my range of motion, and I'm going to reduce the amount of pain there. If you don't have something, you put your leg up, and some people just can't lift their leg up that high. We'll move this chair out of the way. We can just go to a split stance. So I just got 1 foot forward, 1 foot back. All right, and it's going to give me a very similar feel, and it's going to put the load into my legs and take it out of my back. So I'm not putting the stress into my back. I'm putting into whatever I'm working on, exercise I'm working on doing. Okay. The other one is to simply switch to a one-armed exercise or a one-legged exercise. And the advantage of that is we're reducing the overall load on our entire body, but maintaining the load on that one muscle group we're working on. So hopefully that makes sense. We'll take questions at the end so we can talk a little bit more about that stuff if you guys have more questions there, okay? All right, stopping that video there. All right, come on. There we go. All right, so stretching. Oh, I should start the video again because I do have a stretch I want to show you. So stretches can open up a range of motion during your workout. I tend to find that if I have a client that is struggling with a movement because their back pain is flaring up during it, we can do a stretch and go right back into doing that exercise, and they're not experiencing that pain. And they can open up that range of motion, do a little bit more range of motion for the exercise, and just get more out of it. And the first stretch I always teach people with generalized lower back pain is called a piriformis stretch. There's also some things like thoracic mobility and hip flexor stretches. And you guys can kind of look those up or come speak to a trainer or Alex and learn a little bit more about that stuff. All right. So this is called piriformis stretch. And can they actually see my hips here? Let's move this forward a little bit. Cool. All right. So what I'm going to do is I'm sitting down in my chair, and you can do this while you're on the phone at the office, while you're watching TV, Netflix and chilling. I'm just going to take my foot like I'm putting my shoes on. I'm going to gently press down on my knee, and I sit up straight. And if all of you guys want to try this at home right now, you will notice you'll feel a stretch in your hip here. And what that's going to do is that's going to give your hips a little bit more movement. So as you're walking around, your back isn't having to take that range of motion. It's going into your hips. So hopefully that makes sense, guys. This is kind of the first stretch I teach everybody who's dealing with lower back pain. Because you can do it at the office. You can do it anywhere. You can do it in your car. And nobody even knows you're stretching. So you don't even have to be embarrassed about it. And then dynamic warm-ups are also excellent before your workout. These are essentially, you're moving your body through a range of motion without putting a lot of weight on it. And all you're trying to do is get a stretch during your move. Now, we don't want this movement to be explosive, like high kicks or something like that, because that's actually going to cause things to tighten up a little bit. We want it to be nice and slow. So the body gets comfortable in that range of motion and slowly goes, oh, we can relax. We can allow this to happen. This doesn't bother us. Because sometimes that pain will flare up as a way of preventing you from doing something that the body thinks will hurt it. Whereas if you demonstrate that we can do this movement without causing any damage, your body will kind of relax and let you do it and reduce your pain. There we go. I click it. I keep forgetting to click it. All right. Now, prehab. This is a term I like. I didn't hear about it until about 2 years ago. but essentially it's a proactive approach to your physical pain and injuries. So rehab, being afterwards, prehab being before. So we're fixing the issue before it's an issue. Sometimes this includes doing specific lifts, range of motion exercises regularly, or lifestyle changes like getting enough exercise, meeting those minimum requirements, exceeding those minimum requirements. So we'll get into some of what our tips are for prehab. Number one, and Alex stresses this a lot, I know, is don't be afraid of your deadlifts, all right? Deadlift is essentially the same motion as picking something up. I like to think of it as like, if you're a basketball player and you never worked on jumping, you're not going to be very good at it. You're more likely to get hurt if you're jumping. If you never deadlift, you are more likely to get hurt picking something up off the ground as simple as a laundry basket. I knew a guy, he refused to do deadlifts because he was afraid of hurting his back, and he hurt his back picking the dog dish up off the ground. And this guy was in great shape. So if you're not doing those deadlifts, you're kind of just putting yourself at risk for injuring yourself. And we don't need to lift 300 pounds. Start light. Start within what is your capabilities, and limit that range of motion. Make those adjustments. So maybe you're just starting with a 20-pound kettlebell, and you're starting from a chair. You're just standing up out of a chair, holding that 20-pound kettlebell between your legs. Some studies have shown that balance exercises can be very helpful for improving your back pain. Things like one-legged remaining deadlifts, one-legged squats, split stance. But essentially just improving your balance is going to be a big help in preventing your back pain. And once you have back pain, helping with it. And then also just get used to moving your back. Do rotations, flexion, extension, core exercises. And again, getting up and down, just moving generally in your daily life. All right, and just stay active outside the gym or as part of your normal fitness routine. You know, just going for hikes regularly, things like that. Back pain, I see a lot, mostly with people who sit at a desk for their job. They're not moving a lot. Their back is slowly stiffening up. Inflammation is occurring. So try to just set aside time throughout your day to do some light stretching. I just showed you a stretch that everybody can do in the office. Everybody can do from their couch. And you just got to do 30 seconds of stretch. You can do it while you're on the phone. So now you don't have an excuse not to stretch. So I'm going to be mad at you guys if you're not stretching. But just set out some time aside around your day to do a little bit of exercise, some light stretches. My typical recommendation for everybody is stretch in the morning, stretch about lunchtime at the office, and stretch before you go to bed. You just stretch 3 times that day. Those were all times where you have some free time anyways, and you took 2 to 3 minutes to do it. So, there's no reason not to. I think that's all we have for the presentation. I think we should take some questions.
Yeah, do you mind if I'm just gonna
Absolutely.
I'm actually gonna bring this video. I realized we should have had this video going the whole time. Woo, now you get to see my beautiful face.
Yes.
Nobody vomit. Okay, so I just want to bring up that there's no special 3 exercises that are going to be great for everybody's low back pain. I don't know if you're on Instagram or Facebook or YouTube or any of these, but when you see these posts pop up, it's like the 5 best exercises for my back. That's going to be 5 different exercises for everybody. Nobody is going to be the same. That's what we've been talking about. Stretching can be great. Loaded exercise can be great. Just movement, going out for a hike or a walk, or maybe it's just like getting up from your chair and walking to the bathroom a couple times a day. It's just starting somewhere. And a lot of times, so we just mentioned a lot of talking about stretching. A lot of times when we feel like our back is tight, sometimes stretching can be great, but sometimes it's addressing the load intolerance as well. A lot of times we notice a lot of weakness in people's low back, when instead it's weakness, not stiffness. And they're just trying to constantly, man, I feel like I got to touch my toes all the time to get this out. Sometimes it's adding a little bit of load and getting you more comfortable with lifting more things. And that's where Casey mentioned that I love deadlifts, but I just love people being able to pick things up off the ground. That's what we're made to do. How do you go through your life never picking up anything ever again? It just blows my mind. So, but there's always a place to start, and not everybody's the same. We're like you said, we're not going to start with that 500-pound deadlift. Maybe we're starting with a sock, picking the sock up off the ground, and slowly working up and being able to pick up our grandchildren or the flower pot that we need to pick up. We all need to start somewhere, and that somewhere is going to be different for everybody. So, I feel like I can just rant about back pain my entire life. But let's open this up to some questions from you guys. I'm not sure if we're going to need. Oh, we got a chat right there. let's see if we can open up this chat. I'm not sure if people can like unmute and talk. I don't know if that's a possibility, but we got some questions that are sitting in here. So let's go. I'm just going to start from the top. So I apologize for, we'll try to get to everybody if we can, but we're going to start from some of the questions that have been in here since 6:01 p.m. We're starting early. Okay, so the first one is how to tell the pain is arthritis instead of soft tissue. And that's a tough question because arthritis doesn't have a specific pain presentation. It's not like, man, Debbie with arthritis is always going to have pain when she does X, Y, and Z. Sometimes I've seen people with degenerative arthritis where they're just really stiff and they don't have any pain. Sometimes they have arthritis where it's really stiff and it's extremely painful for all different types of motion. I don't like to think of arthritis as this thing that's like, oh my gosh, we got to prevent this arthritis. It's like, we all have it. I've got arthritis. Casey's got arthritis. You guys probably have some arthritis. It's a normal part of aging. Just like I got some wrinkles. Casey's got some wrinkles. I'm missing my hair. The things just happen as we get older. We're going to get arthritis. And I don't want you to worry about the arthritis. But if we're looking at soft tissue, so that's like, we're thinking of muscle, like tendon, ligamentous tissues. And those things we'll be able to notice. Like, so let's take our wrist, for example. If I bend my wrist back this way, I'm going to start to feel some stretch, maybe through my hand and maybe through my forearm. And that's like, okay, we're hitting here and we're hitting some soft tissue restriction there. It's not arthritis in my wrist. You'll usually feel it localized in a muscle. And sometimes that muscle can be a little sore to touch. So the question gets a little hairy there, but I think the takeaway from that is arthritis is not the enemy. Don't worry so much about the arthritis.
And if I remember correctly, one of the best ways to deal with the symptoms of arthritis is to be moving that joint. If I'm not mistaken.
Yep. And that's something that we've been mentioning before. It's the key is we have these joints for a reason. The less we move them, and you see it. So let's take like a hip, for example. In sedentary individuals with hip pain that end up getting hip replacement surgery, you see it more common in sedentary individuals than you do in like a recreational runner. So I think the key is that we need to start using our joints through their ranges of motion, well, within tolerance, of course. Like there's certain issues where we can't bend forward and it hurts, but we need to slowly, gradually start working on that. So
again, the three modifications: load, repetition, and range of motion.
Yeah. And so we got the next question. How long to hold a stretch? Do you want to dig into that?
Yeah. So generally, I see a lot of people, they think that they should only be holding a stretch for about 10 seconds. That's not really going to do anything for you. So generally my recommendation is about 30 seconds. That's about how long it takes for something called a Golgi tendon organ, which is a nerve that detects the tension in that muscle. And if that tension has been there for a long time, it tells that muscle to start allowing more range of motion. So you want to hold it for about 30 seconds. I think it's very important to understand, though, that stretching is not going to solve the problem. Stretching is a way to mitigate some of the issues. And like we've been saying, it's being able to increase your load and the durability of your soft tissue through things like lifting and strength training are what's really going to be the way to solve the issue. Stretching is just a way to make that a little bit easier to reduce symptoms at the moment.
Yeah. Okay, so we got some other in here that might be a little tough. So we get somebody saying, let's see, where's that? So stretch, we just did that one. My back pain shows up during the night in bed to the point that rolling over hurts a lot. It gets better during the day. I'm not sure if that's a comment or a question, but yeah, if you want to elaborate on that, please throw that in the notes, please. So somebody else is saying, I have spinal stenosis. I'm concerned about aggravating the condition. Any thoughts or suggestions? Totally. So just realize that like low-grade movement and testing these things out is not going to make your spinal stenosis worse. Spinal stenosis and arthritis are very similar in the fact that they're very age-related. Obviously, certain people will have it more than others. And usually when you're seeing spinal stenosis, it's things like that extension, that standing upright usually tend to bother it a little bit more. And if that's not your case, maybe it's like, maybe we got to rethink, is it really spinal stenosis that's causing that issue? With these things, we talked about it earlier, and it's testing out those motions. Like if we're bending forward, so we bend forward once, okay, maybe we're getting a little bit of pain. Okay, back off. Is your pain still there? Usually my rule of thumb is if you can do something and then almost immediately when your pain can go away or starts going away, that's a good sign. It's an issue when we repetitively start bending forward and now the pain's getting worse and worse and worse. And now it's lingering for 2 or 3 days. That's something where it's your body's kind of telling you, maybe we need to modify this motion a little bit. Maybe we need to stop bending forward just for a little bit, or don't bend forward as far. But on the same turn, if you can bend over 5 times and you keep getting pain, but then you stand up and it goes away, that's not something to fear. We're not doing damage to those structures. That's something that we need to play with, and we need to modify our movement. So that's kind of where I'd go with that. So, but honestly, it's really hard to do this without knowing your specific presentation. This is something where seeking out a good therapist that's going to listen to you, sit down and listen to what you have to tell you or what you have to say, and come up with a game plan based on what you're presenting with. That's somebody that you need to find that's going to give you the time of day to do that. And we at IRG are all ears, and specifically up here in Mount Vernon, PT and urban fitness and health. I'd love to get you guys in and try to help you with this if you get a chance. So
Helen, so if I'm reading that question correctly, when in pain, it seems like you're asking what you need to do is stretch and exercise. It is going to depend on the pain. You should talk to probably a doctor or a physical therapist about what is causing the pain. But if it's generalized lower back pain, which is what we've been talking about, where there isn't really a specific cause, and there's no contraindications for exercise, that absolutely yes, stretching, exercise, and really the exercise, more stretching is part of exercise. So the overall exercising, being active is what you need to do. You just need to make sure you're doing it within your limits and slowly build yourself up. You got to start somewhere and build up from there.
Cool. What if hip or back pain, constant low-grade ache when lying in any position in bed is preventing a good night's sleep?
Yeah, and that's where it gets trouble, because sleep is one of those things that I spoke about. It's on that spectrum where we need to, the more we can improve our sleep, the more we can improve our diet, the more we can improve our stress, and the more we can improve our movement, are going to help those things. And it gets really tricky when we're trying to address sleep, because it's not like I can have you do Casey's like pigeon stretch while you're laying in bed sleeping. These are things that we need to address, obviously, while you're awake. When we're sleeping, it's like, let's try to find the best position that we can get into. But a lot of times I feel like when we're sleeping, we sit there or we try to lay in bed and we're there for like 8 hours, we're not moving, things get stiff and uncomfortable. We address this with well, it depends on your presentation, but we're going to address this with movement throughout the day, and exercise, depending on if we're seeing muscle weakness or stiffness. And we're going to address these. And as we start addressing those factors, your sleep is going to improve with your pain. I guarantee it. So, but this is something where it's like, we need to get you in, and it gets hard when we got these specific cases, but we need to get you in to see somebody. And this is something that we do a really good job treating here. With physical therapy.
Something I would just add on the end of that is something you can do, before you come in and see us, is do try to just stretch a little bit before you go to sleep, in addition to finding those more comfortable positions. That's something you can do tonight. Being able to tell you what stretches to do, we can't do that without actually seeing you. But if you're just generally working on stretching out the joints that are bothering you, where your pain is and things like that, it should help alleviate some of that discomfort, and you'll be able to get a more comfortable night's sleep for a little bit longer before things start to flare up. Yeah. And then we've got what exercises are best for back pain? Just kind of want to reiterate the point that everybody's back pain is different. I do have a sample exercise routine here that is kind of, if someone were to call me on the phone and say, hey, I'm going to come in and I've got back pain, and I want to do a consultation. We get them in here, and what I would start, the framework off of which I would build their exercise routine, we'd start with something like overhead lat pulls, which aren't going to require too much stress from the back, a one-armed cable press. So you're just pressing forward with one arm to reduce the amount of load, as opposed to something like a bench press. We're going to do chops. Some people, this is actually not a good choice for, though, because they don't have the abdominal strength to do that without using too much stress on their back. And then split squats, I generally recommend, or essentially a walking lunge can be beneficial as well. But those are some options, but those aren't going to work for everybody. Some people can't do a split squat. They just don't have the balance for it. Some people have trouble reaching overhead and can't do a lat pull, so that's not going to work for them either. It's really, or some people just aren't strong enough to do, like I said, the cable chop. Yeah. Some people, cable press isn't going to be necessary. They could do a bench press just fine because the way their back pain presents. Yeah. So it is really, you need to come to the gym and kind of learn what exercise you can and can't do. And that's, we're talking to professionals as we kind of guide you through that process, because it is a little daunting.
And it's not something I get a lot where people are coming in and they're saying, but my core is so weak. Just realize that's a bigger picture than that. It's so much more complex than just, my core. We need to address the root cause. It's not just everybody with back pain gets core exercises, or like Casey's saying, not everybody with back pain gets split squats and lunges. It just depends on what you can do. And we're going to modify that for you to figure that out, because if you can't bend forward forward, your treatment is probably going to be very different than somebody that can't bend backwards or can't stand or these kind of things. And that needs to be individualized. And there's no one specific one that's going to be perfect. And anybody that tells you there's a specific exercise that's going to cure all back pain, leave. Don't listen to them, because it's not true. Okay, so we got another one. Somebody saying the tip is to lay on the side. So they're talking about sleeping. So we got a question about like the best positions to try to sleep in, and somebody said, "Hey, try a pillow between your legs." And I think that stuff's great. This just gets back to experimenting. Try the pillow between the legs. If that doesn't work, try a pillow under your back, under your hips. Sleeping with a body pillow in front of you. This is where the experimentation that comes into play. We don't know what we're dealing with until we know what bothers you. And that's one of the things that we're going to ask you when we first get you in here is, what kind of things make you worse? What kind of things make you better? And then we build a plan off of that, working with you to figure those things out. Because like we said, it's not going to be the same for everybody. I've seen it where the pillow between the legs makes things completely worse. I've seen it where the pillow between the legs gives them a good night's sleep. But that's where, try it out. Worst thing that happens is you're like, heck, I don't like a pillow between my legs, and then get it out of there. You're not going to make anything worse by testing it out. Cool. Okay. Is this a new one? Oh,
Yes.
Man, we got two screens going at once.
Strengthening often involves some pain, no gain. How can I distinguish between strength building pain and pain that says stop? Do you want to take that one first?
Yeah, I'd love to take that kind of stuff. And so I mentioned this a little bit before, but my thing with pain is that, so not all pain is bad. So we're gonna start working out, and then we're gonna assess our pain. Okay. So let's take a lifting from the floor. So we're doing a deadlift. I lift from the floor. I do 5 reps, and I'm like, my back's a little stiff. It's a little achy. I stop for a second. I regroup. I take a minute. I see, okay, after a minute, where's my back at? Is it still sore? Is it something that I can live with? Is it something that I cannot live with? And clearly, if we have weakness, we're going to get a little bit of discomfort with that. If we got something else going on, we could get discomfort with that as well. If it's feeling okay and it's tolerable for you, let's test it again. Let's see what happens. Okay, I do another set of 5 or 10 or what have you with a light weight, or just bend it down to touch toes. Where's my pain at now? What's my pain at while I'm doing it? What's my pain at afterwards? If you're just getting sharp pains in your back that's shooting down your leg and your feet are going numb and things are just getting worse and worse with this movement, the more you do it, and now you have pain for like a day or 2 after, we need to back off and we need to change that. But a lot of times, like some of these pains, we need to start pushing into. And if we can tolerate it and you're doing okay, and for the most part, your pain's going away pretty quickly, let's keep moving into that. Let's kind of test that. Let's test the waters with that. Worst thing that happens is we find, okay, this hurts. I don't like this. We stop, and then natural history will come back, and it'll start making things feel better. And that's another, I just want to touch on one point real quick before I jump into this. Our bodies are so good at healing themselves. When you get a cut on your skin, your body's gonna heal it. When you get, you break a bone, like you cast it up or what have you, put yourself in a sling, it's the body's gonna heal that. Your body is trying as hard as it can to heal your body, no matter how terrible you are to it. We can feed it the worst stuff in the world. We can just do the worst stuff to our bodies, but no matter what, as long as you're still breathing, your body is going to try to heal. And that's the same thing on the inside of your body and the outside of your body. And let's test it out a little bit and let's see what we can and cannot do. Sorry about that.
Yeah, no problem. So one of the things, the problem with the question of which pain, how do you distinguish between kinds of pain? If pain is such a universal term for something that has so many shades of gray inside of it. Like Alex used the word shooting pain. There's also burning pain. There's sudden pain, chronic pain, things like this. So we need to talk a little bit about like the different kinds of pain you can experience. What I usually use as a good measure when I'm working with my clients is if a client stops the exercise and the pain goes away, then they're probably fine. If the pain persists well after the exercise and continues to get worse after the exercise, that's a no-no. We need to stop. We need to address that. We need to do something different. Generally, also, if you have a lot of experience working out and lifting, and some people don't, and that's fine, you can start to tell after a little while. You can tell the difference between like, oh, my muscle is just getting a workout versus, oh, there's like a sharp pain. But essentially, it has to do with how quickly does it come on and how long does it persist. So if it comes out of nowhere and hits you hard, that's something that you need to stop and take a look at, and just that's when it's time to modify. If it's as I do this lift, this muscle is starting to bother me a little bit, well, that's what lifting feels like. And if it's when you're done with the lift, it persists a little bit, but it goes down and it feels fine, then it's probably okay. If you're getting to a point where after the lift, you've done a bunch of reps and now that part of your body is starting to get real sore, that means you're overloaded and you can stop doing that exercise and move on to something else. Yeah. But really, it's about how quickly does it come on and how quickly does it go away? Because if it comes on very quickly, it's a problem. And if it sticks around for a while, it's probably a problem as well. But you will get delayed onset muscle soreness, where it'll stick around for a couple days, and that's the burn that we're talking about. And it's I guess tolerance is really what it's more about. Is can you tolerate that pain for the day? Because sometimes I've done a lift and I wasn't injured, I just was so sore I couldn't do anything the next day. That was too much. But I try to aim my workouts for I feel comfortable the next day. I'm a little sore, but I'm fine. So yeah, tolerance. And if you're getting those sharp pains that come out of nowhere, then it's time to, if you can't tolerate or it's sharp, that's time to address it.
Yeah, and just realize that that's what we do. Like, it's so much cheaper to go in and just see a PT for one visit, even if you just need a little bit of guidance and you just want to ask some questions like that. That's what we're here for. We don't have to take you through 6 to 12 to 24 weeks of physical therapy. Maybe it's just something where you want to talk to somebody. It's like, just get in the door. Let's just start that conversation and let's make you feel resilient and strong again. Because I feel like our medical system does such a good job of breaking people down and scaring them. That shouldn't be the case. We're resilient human beings. We can go through a lot. Even when we're in pain, we can go through a lot. And that's what we're here to do. We're here to help you. Give us a call. Reach out to your closest physical therapist. Come see us at IRG, man. We love this stuff. I can sit here and talk to you guys about this all day. Come in my door and let's dive through this and let's get you guys feeling better and moving better, because that's what this is all about. Nobody wants to go through life feeling crummy all the time. Like, let's get you on the right track to feeling better. So
yeah, something I'd like to point out is if we're working with you and you go, that hurts, we don't say stop or keep push through. It's we sit down and go, oh, well, what do you mean it hurts? Let's talk about it a little bit more. We go through, because the other thing is like we said in the presentation, pain is complex. It's going to be the same injury or the same problem is going to present differently in everybody. So every time my client tells me, oh, that hurts, we talk. I've spent 20 minutes trying to figure out what kind of pain we're doing with a new client, what kind of pain we're dealing with a new client. We decided, oh yeah, we can work through that. That's fine. So that's kind of, you'll learn as you work out. So I think the important thing, just get started and learn these, and we'll learn these things. You go and experiment a little bit, and just remember, you don't have to start crazy. Take it easy and work your way into it. Build yourself up.
Cool. I think we've kind of addressed this. Any more final questions before we sign off? I'm not seeing any more shooting through. So if you do, please type something in there and we'd be more than happy to ask it. If not, it's been a pleasure sitting down and talking with you. I don't know what you guys can see versus what I can see, but maybe I shouldn't close that. That's okay. It's been a pleasure sitting down. We love to do more of these. We could do this on the shoulder. We could do this on the neck, on the hip, the whole thing. But I feel like a back is a very scary one that a lot of people, it can be very debilitating. And I hope we at least put a little bit of confidence in you to test it out a little bit. You're not going to be making things worse. It's okay. Natural history, things will slowly start getting better. That's what they do. Oh, boom. We got what did that just say? Is that a chat? We got a chat. Thank you. Oh, well, thank you very much. I appreciate it. I love doing this. I could do it again. But all of you guys, do you got anything? I was just going to say,
Just leave that up. So
we can see. But enjoy the rest of your week. And please, if you got some back pain, reach out to us. That's why we're here. Cool. Of course. Boom. Okay. I like it.
Yeah.
Thanks, Dallas. Okay. We'll see you guys later. We're going to sign off. Have a wonderful week. Enjoy this. Let's get some sunny weather and let's get outside.
Yeah.
Okay. How do I turn this off?
Oh, there you go.
Stop. Here we go. Yeah.